I'm Frederick Isasi, Executive Director of Families USA. Due to COVID-19, the United States is facing its greatest health and economic emergency in more than a century. The rapid spread of COVID-19 has devastated families across the nation. In order to curtail the damage, this pandemic has already caused bold action is needed from Congress. One, we need a federally coordinated and funded plan to test, trace, and quarantine individuals in order to reopen the U.S. economy and keep families safe. Two, we must ensure that all families have health insurance through Medicaid or private coverage to keep them safe and protect them financially during the pandemic. And three, we need to ensure federal financial support is provided to states to staff pandemic response, save jobs, and help hard-pressed residents through state programs like unemployment, food programs, children's programs, programs for the elderly, and on. Today, we've invited Dr. Sharfstein to answer questions about testing, tracing, and quarantining. Following that discussion, we'll talk briefly about the two other priorities, keeping families connected to health insurance and providing state fiscal relief. Let's begin by welcoming Dr. Josh Sharfstein, the Vice Dean for Public Health Practice and Community Engagement at Johns Hopkins University, and a renowned public health expert. Dr. Sharfstein has a wealth of experience in developing and implementing evidence-based strategies to combat health crises, including the work he's done as Deputy Commissioner of the FDA, as Maryland's Health Secretary, and now as Vice Dean at Johns Hopkins University. Within the context of COVID-19, he is once again a leader in understanding how the federal government, states, and communities can most effectively respond to the pandemic. So let's focus today's discussion on what Congress can do to build a robust public health response to this pandemic and how to help families and workers protect their health and financial well-being in the midst of this deadly disease. Welcome, Dr. Sharfstein. Thanks for joining Families USA for this discussion. So to begin with, it seems like almost all public health and medical experts are unified around the idea that to reopen the U.S. economy and keep families safe, a comprehensive effort to test, trace, and quarantine individuals must be nationally coordinated and implemented in all states. Do you agree? And can you explain why this is so important?
Well, what we're trying to do here is to stop the virus from spreading from person to person. And the best way to do that is find out where the virus is. That's where the testing comes in. And have people who are infected isolate themselves to reduce the chance that they can pass it on to anyone else. And then find the people they may have already passed it on to and have them quarantine themselves. Again, so even when they get infectious, there's no place for that virus to go, no one else to infect. That's really been the basis of successful strategies in a number of other countries against the coronavirus. We have to build that capacity in the United States because we have only a very small contact tracing capacity before the pandemic struck, and we're going to have to scale it up. And it's a really high priority because when you can control infections through contact tracing and prevent outbreaks, then you don't have to do things like tell everyone to stay at home or shut down big parts of the economy.
That makes a lot of sense. We've seen wildly different estimates of what is needed in terms of the number of tests that should be performed each day, some that go as high as 20 million. We've also seen a lot of variation in the number of contract tracers that need to be hired. What would you recommend to Congress on the funding, human capacity, and supplies needed to develop and implement the infrastructure needed to address the crisis?
So on contact tracing, I think most people talk about somewhere around 100,000 contact tracers for the country, and maybe a little bit more than that. And in addition to the contact tracers, you need to be able to provide resources to help people stay at home. So that may be food delivery, or in some cases, financial support if people can't afford to stay at home. And in some extreme cases, it's necessary to provide somebody an alternate place to live, so that they are not around other people. So if they're living with, 5 roommates in a small place, you really need to find that person a hotel room for a little bit so that they can be safe and not passing the virus on to other people. So if you put all that together, it's probably somewhere in the ballpark of about $40 billion. But that's money that's very well spent because not only is it, putting money right into the economy, but it's putting money into the economy in a way that reduces the spread of the coronavirus, which just generates more room for the economy to open. So it's a very smart investment in my view.
It makes a lot of sense. We put, compared to the rest of the funding that's flowing into the economy right now for crisis relief, we're putting a small amount in, $40 billion, that allows us to keep people safe and let the economy continue to open up and continue that economic development. There's a lot of questions about who should stand up these operations, these testing, tracing, quarantine operations. Should they reside mostly at the federal or state level or local level? What are your thoughts?
Well, ideally, you'd have a lot of strong direction from the federal government. Right now we have some basic principles from the federal government, and I'm not sure how much strong direction is going to be coming from the federal government. So it's really being left for the states to support. And obviously the states and localities work together. At Johns Hopkins, we created a free online course for contact tracing that's available on the Coursera platform that already there's some cities and states already they're using it as part of their hiring process for contact tracers. So, the goal is to stand up strong programs and at least have a network of them across the country, if not fully centrally coordinated.
And that we've heard a lot about how federal and state procurement processes can be burdensome and time consuming. Are there any specific strategies that we can use to expedite the way these funds are getting to the communities that need them more quickly?
Well, there are a couple of different issues. One is if the federal government's going to make funds available, it should be very, very rapidly accessible for states and localities. And then second of all, the states and localities need to have very nimble processes for hiring people. And there are different ways to do that. You could partner with an organization that is then going to go out and hire all the people, or there are sometimes some special hiring authorities that states and localities can use. But this is not a situation where you're going to post a position and then interview 3 people for each position, and 6 months later you're going to be able to hire someone. It's got to be done very quickly. So, speed is very important when you're dealing with a virus that's this deadly and this quick.
Yeah, absolutely. And it sounds like either through contractors or through getting special authority to do quick hiring is very important. And a kind of related question, we know that low-income communities and communities of color are being disproportionately impacted by this crisis. How can we ensure that the critical resources that these communities need, they're getting them, and that the models for testing, tracing, and quarantine are tailored to the needs of these communities, including things like walk-up testing sites and support services for quarantine?
Well, it's a great question because the whole of our society depends on everyone being able to get support. And it just doesn't work if there are big parts of our society that are having outbreaks. Then we're all at risk. So particularly for contact tracing, it's very important that there are people who have the trust of their community in order to get key information to protect the community. Our contact tracing course at Johns Hopkins is available for anyone who has a high school diploma, and there are a number of contact tracing programs that are contemplating essentially a community health worker model. So you can hire people from communities to go and stop the spread of the virus in their own communities. I think that's a great idea. And then you have to support all of the various people involved with resources. So just like you said, food deliveries, income if there's critical lost income for somebody while they're quarantining, and as well as the opportunity to move them to a hotel. All those things have to be available in every single community for us to be able to do a real blanket of protection.
And let me ask you one more question. There's been a lot of discussion about how important the role of community health workers in testing and tracing could be. And I'm just wondering, how do you think states can best utilize community health workers? And are there any federal barriers that need to be addressed in order to really allow community health workers to step into this role?
So I think that there are a few different roles they could potentially serve. One is contact tracing. One is the support specialist, somebody who's going to follow up with someone in quarantine and say, how can I help you be successful in quarantine, and connect with resources. I think that's another great role for community health workers. I think that the most important thing right now for the federal government is to provide the funding. I don't think there's a particular obstacle that I'm aware of for states to decide to hire community health workers as part of their teams for public health protection. But the funding is very important, the funding both for the staff and for the resources that are required.
Yeah, absolutely. And for example, within state Medicaid programs, there can also often be concerns about whether or not the Medicaid program allows for direct payment for community health worker services. But as you said, the barrier for community health workers to step in this role is mostly about funding.
Yeah, well, I think you're making a good point. Certainly, there may be particular issues at the state level that may be there. I do think that it's very important not to let those sorts of things inhibit the response to coronavirus. And CMS has been pretty flexible at agreeing to state requests to waive particular regulations that are inhibiting the response.
Thank you very much, Josh. This has been a very helpful conversation. Obviously, this public health response is the critical issue to us being able to return to normal, or perhaps a new normal. Before we wrap up, could you please give us your thoughts about the importance of ensuring all families have access to health insurance coverage and why funding for states is so important in addressing the COVID pandemic?
Sure. So for the first one, health insurance is absolutely essential because we want people to get care as soon as they need it for the coronavirus and for other conditions that are affecting them. But let's just take the coronavirus. If people are afraid to go to the hospital because they're worried about getting billed, then they'll stay at home while they're infectious for longer and cause more infections. So it's an extremely expensive proposition for society for people to be at home instead of seeking the help that they need. The other thing is there's mounting evidence that early medical treatment really helps. For example, oxygen to reduce the stress on the lung of the infection. So I think while maybe not yet fully established, I think there's a lot of reason to believe that early medical attention helps. So it's both to save the lives of the individuals and all the people around them who could get infected. We want people to seek help and not be afraid because of financial barriers. And that's a major issue. And we've certainly heard terrible stories about people not wanting to get treatment and even dying. And so that shouldn't happen in this country. And then to your second question about states, states are really at the center of the response right now. And that is in large part because the federal government has decided that it would take a very high level role in giving some very broad guidance and leave a lot of key implementation decisions to states. And so with that comes the need to support states in being able to be successful. And, you know, states have to balance their budget. So that means if they're going to spend money at a time when tax receipts may be going down because of the economy, the states need to find money from somewhere. And the federal government has a number of different levers, including changing the federal reimbursement on Medicaid or other direct payments to the states that really will be the difference in whether states can mount a successful response, I think.
Thank you very much, Dr. Sharfstein, for a very informed discussion. Where can people reach you if they'd like to stay up to date with your work?
Sure. Well, we've got a couple avenues. I'm on Twitter at Dr. Josh S, DrJoshS. We have a podcast at the School of Public Health called Public Health on Call, and you can get that wherever you get your podcasts. We're closing in on 1 million downloads of podcasts all about the coronavirus. And then there's the Johns Hopkins coronavirus information site, which is coronavirus.jhu.edu.
Fantastic. And if you want to check out Family USA's resources, go to familiesusa.org or at familiesusa on social. And our website, we have a COVID-19 digital toolkit that contains helpful information, including our just released one-pagers and key messages for policy priorities that we discussed today. And I'm Frederick Isasi for Families USA.